Okay, latency. So this is a chronic process. This 3-step carcinogenesis takes time, so it's always going to be chronic. Latency describes the time between initiation and clinical detection, which is often quite long. So for animal cancers, it's often many years. In humans, it can be decades. The smallest clinically detectable tumor mass on imaging is about a centimeter. So that's 10 to the 9th cells. That's a lot. That's a decent number of cells. So it takes time to even detect these things. However, for human cancers and hopefully, knock on wood, eventually for animal cancers, latency is decreasing as we develop biomarkers and more like early detection and screening tools. So you might not see it on imaging, but can you see it in the blood? Is there something in the blood that we can detect? So that's an important one that we use. Okay, epidemiology of cancer. This is generally, because it takes time, it's going to be a disease of middle to old age in animals. Is most commonly seen in dogs, cats, and horses. Why is that? Why not? Because we eat them. Yeah, we don't see as much cancer in things that we eat because we don't allow them the privilege of developing cancer. So it's most commonly for you guys, you're going to see it in dogs, cats, horses, birds, pets, things. There are really important species and breed-specific predispositions and associations with regards to some species or breeds develop specific tumor types at a higher frequency, but also the occurrence of benign and malignant is different depending on species. Mammary tumors are a really good example of this. For the NAVLI, I had a question on my NAVLI that was like, here's a bunch of animals, tell me which one's most likely to die if it has a mammary tumor. It's like, oh God. So cats, feline mammary tumors are pretty rare, but when we see them, they're usually malignant. Versus dogs. Dogs get mammary tumors all the time, but they're often benign, especially if the animals have been spayed. We don't really see mammary tumors in cattle, partly because we eat them, partly because they lactate, and lactation reduces the risk of cancer. There are a couple exceptions to this rule of cancer being a disease of old age. Cancer is caused by viruses, so like Papillomavirus in the mouth of a dog. Those are going to usually be young animals. There are a couple inherited or congenital neoplasms. We usually call these blastomas to denote they're like a fetal or like an embryonic origin. Those are going to be seen in young animals. And then leukemias, I don't know about in animals, but in humans, they're bimodal, which means there's a peak in the young and then there's a peak in the old. Okay, so what actually causes cancer? So there's both intrinsic and extrinsic factors in humans, and this is probably also likely true of a lot of animals. Number may be slightly smaller because we have more genetic factors in animals. A lot of them are more inbred, but a lot of the extrinsic causes of cancer are the main ones. So about 3/4 of human cancers are thought to be initiated by external factors from the environment. Breed-specific intrinsic factors, some of these associations are quite strong. You have to be careful because this can be useful, but you can't see a patient with a tumor and assume, oh, it's a greyhound, that must be an osteosarcoma, because greyhounds always have osteosarcoma. It's useful, but just be careful with that. So question for you guys, these intrinsic breed-specific factors, what do you think their role is in causing cancer? Do you think these are initiators or promoters? Who thinks initiators? Who thinks promoters? Who didn't vote? I saw a few more votes for initiators. I think that's probably correct. That's a guess on my part. Actually, but all right, one more slide. So chemical carcinogens, there are quite a few of these. You don't need to really know or learn them. You probably are already familiar with a lot of these. Some are purely initiators, some are complete carcinogens, some are just acting as promoters. But these are all things that have an effect on either your DNA or your cellular proliferation. These are of increasingly recognized importance in animals. So I said that 3/4 of human cancers are caused by environmental exposures. How does that work for dogs and cats who share like 80–90% of our environment? They're probably getting the same exposures. So this is showing changes in P53, the tumor suppressor gene, with cats who are exposed to environmental tobacco smoke and develop squamous cell carcinoma. Also looking at things like household chemicals, pesticides, things like that. So another big important area of research. What can we learn from our pet population about what we're exposing ourselves to in our environment with diet, air quality, and all that stuff. All right, radiation causes severe DNA damage. It's actually very difficult for the cell to repair. It's big things like double strand breaks, like cross-linking. UV is a really important cause of squamous cell carcinoma, so that's a major risk factor across species, especially in cattle and especially in lightly pigmented areas. Also note that electromagnetic and particulate, so therapeutic radiation, X-ray, proton can also be a carcinogen, even if we're using it to treat cancer. It can also cause cancer. All right, nice segue into chronic inflammation. Is a carcinogen. So we talked about during chronic inflammation how chronic inflammation can lead to neoplasia if it's allowed to proceed. This can be induced by a wide range of things. So anything that causes chronic inflammation, so trauma, foreign body, vaccines. We're talking about cats, especially. When you think about a vaccination that we've added adjuvant to, the purpose of adjuvant is to increase the inflammatory reaction, right? To get a better immune response. So a downside of that is too much inflammation. And essentially these inflammatory and more like physical irritant carcinogens are acting as promoters. So it's a growth stimulus. You're getting all those proliferative cytokines from chronic inflammation. And that's a cancer promoter. So injection site sarcomas in cats, super common. This is why we started vaccinating from the distal limbs. We used to vaccinate a lot more between the scapula, but sarcomas there, this is a malignant tumor, so they're much harder to remove there. A lot easier to do a limb amputation than a scapula amputation. Another classic example, less common, we see this more in like wild animals. Spirocerca lupi, it's a little nematode. It's a little red worm that burrows into the mucosa of the esophagus and induces chronic inflammation because the body can't remove that stimulus. The tissues around the nematode and around the inflammation very commonly undergo neoplastic transformation. So this results in introthoracic fibrosarcomas, osteosarcomas, occasionally chondrosarcomas. They can invade the esophagus, the aorta, pretty much get those structures. And then less important for you guys to know, but you might know a person that has had this condition called Barrett's esophagus in humans. It's basically from chronic acid reflux irritating the distal esophagus and causing chronic inflammation. Just like this worm, that's a stimulus for potential neoplastic transformation and cancer promotion. Okay, oncogenic viruses. So remember that these are going to be the exception to the rule that cancer is the disease of old age. Cancers caused by viruses are going to occur much more commonly in younger animals. So these are kind of the major classes I would like you guys to know about. These are some minor ones that you may hear about, but they're not as common and not quite as important. They're just kind of like one-offs. So a couple basic mechanisms of how viruses could cause neoplastic transformation in the cell. They can do it by something called dominant viral oncogenesis. That's where the virus, usually going to be a DNA virus or a retrovirus, is going to carry an oncogene in its genome. So when the virus inserts into the host genome, you have gained an oncogene. And once that's transcribed, it's going to start just the same as if you had a proto-oncogene, a host proto-oncogene mutate into an oncogene, it's going to be the same effect. It's going to be integrated into the gene. That's dominant viral oncogenesis. There's also something called insertional mutagenesis, basically where the virus is inserting in the genome is causing a mutation in the host genome. So the place it's inserting is causing a disruption in how the host genes are transcribed. So the virus itself doesn't contain any oncogene or proto-oncogene. It's just that where it's inserting in the host, it might be inserting near a host oncogene and causing that gene to be transcribed, but it's having an effect on the host gene. There's also something called hit and run. It's basically like our version of idiopathic, but it sounds better to call it a hit and run because it's like it's somebody else's fault. It's not our fault. We're not idiots. So this is just, we don't know the mechanism and it's difficult to find out because the virus isn't present in the tissue anymore at the time of tumor development and investigation. So we can't find the virus. We don't know how exactly it's causing this. And then there's also indirect oncogenesis. So the virus isn't necessarily inserting into the genome or doing anything to the host genetics, but it's altering the host cell in some way indirectly to favor tumor development. So maybe it's causing chronic inflammation and that's acting as a tumor promoter. Maybe it's altering the microenvironment in some way, but it's indirect. It's not inserting in the genome. And the mechanisms are just indirect secondary effects. Okay, so retroviruses. So most of these oncogenic viruses are going to be DNA viruses. The exception is retroviruses. They are RNA. Virology is next year. Yeah. So basically what retroviruses do is they contain a reverse transcriptase. So transcription going from DNA to RNA, reverse transcription, RNA to DNA. So it's going to turn the virus into DNA and then it can integrate in the genome. So there's two different mechanisms from these four we talked about. This one does two, the first two. So there's two different types of transformation and they basically correspond to two different mechanisms. One is a dominant viral oncogenesis and one is an insertional mutagenesis. So cells undergo rapid or acute neoplastic transformation with retroviruses like avian sarcoma is an example of an acute transforming retrovirus. Basically, the provirus, the DNA has been transcribed into DNA. That's now a provirus. That's what inserts in the genome. So that contains an oncogene, which inserts into the host genome, and then it gets transcribed into the genome. So that's dominant viral oncogenesis. There's also slow transforming retroviruses, and these are the ones that don't contain an oncogene, but the place where they insert is usually near a host proto-oncogene and it causes activation of that. So this is going to be that second type insertional mutagenesis. So this is going to be things like bovine and feline leukemia viruses. They're a lot slower onset in general. The point of these is to increase viral replication. So if a virus has an oncogene or can insert near an oncogene, that's going to it's going to get itself transcribed because it's near those transcription proteins. In general, retroviruses are pretty species specific, so there's not a lot of cross transmission, with the exception of some of these. Where are they? The small ruminant lentiviruses, the Exiki sheep retrovirus. There's a couple of ones that Herpesviruses, CAE. Those ones go back and forth between small ruminants, so they transmit between sheep and goats. And then HIV, SIV in primates and humans, those are transmissible. So HIV is contagious to us. Okay, classic example of an oncogenic retrovirus is bovine leukemia virus, or BLV. This is one that's contracted through contaminated equipment, injections where people are using the same needle over and over to save money, dehorning without sterilizing equipment. And basically what this does is the virus integrates into the genome specifically of B cells. It contains this TAX protein that is basically increases transcription. So basically what happens is it's trying to increase transcription of itself, but it's also causing transcription of these cell growth genes. It's acting as a promoter. Yeah.
You know what to do selective like in hereditary negative this, or
I don't.
it's only 5%, right?
I don't know. I would assume no, because it's a pretty indolent. They probably just live with it. I haven't seen this a lot here. I've not seen a lot of cases here. So yeah, not exactly sure how that would be handled on a herd level. Yeah, majority of animals are it's going to be clinically silent, so you probably might not even know there's a problem in the herd until you get one that pops up. This is a cutaneous, but they'll also get like internal masses, usually like the sublumbar, the iliac. You can feel them on palpation. It feels like they sprouted a third kidney. One thing I can palpate. Okay, this is FYI, you don't need to know this, but I know a lot more about this one, so this is what I like to talk about. Mouse mammary tumor virus, or MMTV, is another oncogenic retroviruses. So this might be a fun fact for you guys. A lot of your genome is actually retroviruses and parts of retroviruses that are just in there and left over from evolution. Most of them aren't doing anything. That's about 8% of your genome. In lab mice, which we have inbred the shit out of to make them genetically homogeneous, over 30% of their genome is retrovirus bits and pieces. Isn't that crazy? 30% of the mouse genome is viruses. That's nuts. I find this nuts that 8% of mouse is viruses. Crazy. So this is present in pretty much all inbred mouse strains. They have at least one copy. Most are defective, so they're like old bits and pieces of virus. They don't encode active virus particles. There's no viral replication going on in these animals, so they're clinically silent in most mice. There are a couple strains where they actually have active virus. So in these strains, they have an extremely high prevalence of tumor development. So this is a C3H, this brown guy, this is an SJL, the white guy. The virus is transmitted in milk, so as soon as the pups are born and start nursing, they get MMTV, and 100% of them develop tumors by 9 months. So if you have this virus, you will get a tumor. It causes a different disease in a different strain. So in the strain, it likes to insert in lymphoid cells, and they get B cell lymphomas, 90% of them. So very, very high prevalence if you have active virus. Okay, oncogenic herpes viruses. So herpes, these are DNA viruses. They tend to cause lifelong infection in the host. That's kind of the commonality of herpes. So we have this concept of latency. Often they're going latent in neural tissue. Some of them will integrate into the host genome, kind of similar to a retrovirus. Others maintain like a little piece of like circular DNA latently in the host nucleus. And then when you're under stress is when these herpes virus start to be transcribed. A lot of them are immunosuppressive, so they kind of, once you're stressed and a little bit immunosuppressed, they'll make you a little bit more immunosuppressed. There are 3 classes of herpes, alpha, beta, gamma. Usually gamma herpes are the ones that are going to be oncogenic. The important exception is Marek's disease, which is very common. That's an alpha herpes. Usually alpha herpes in general are like necrotizing. The cold sore virus is an alpha herpes. That's kind of the classic presentation. It's necrotizing, ulcerative. Gammas are usually the ones that are going to cause oncogenesis. There are a lot of examples. Again, sorry for the lab animal thing that you probably don't know for Davley. But there are a lot of herpes viruses in old world primates that when they transfer into their non-native host, a new world primate, they get lymphoma. So this is a owl monkey that was unfortunate enough to come into contact with a squirrel monkey. They traded herpes and this guy got lymphoma. Okay, so most important oncogenic herpes for you guys to know is Marek's disease. This is Gallon herpes 2. Again, it's a little bit weird because it's an alpha herpes. Most of these are Gallon. This guy's unusual. But this is a really important cause of lymphoproliferative disease and lymphoma in chickens. It is extremely common in this area. It has a very high prevalence, especially in backyard flocks. So we see these spontaneous deaths from lymphoma, leukemia, and a lot of backyard chickens around here. Oncogenesis, I don't want you guys to memorize this, but it's interesting to know how this is working. Viral integration specifically is into T cells. So it's causing neoplastic transformation and then clonal expansion of T cells. It's complicated. There's multiple oncogenes involved. It's also downregulating post-tumor suppressors by where it's inserting. So this causes kind of broad immune suppression, and you can't kill the transformed cells. So it's doing a lot of things that promote oncogenesis. Which is why I don't want you to memorize it and worry about it, because I don't know how it totally works. Don't expect you guys to remember it. Pathology is pretty classic. You basically get lymphomas and leukemias and infiltrates of weird looking neoplastic lymphocytes in many tissues. These are the most common, but I've seen it in essentially every organ. This is a pair of eyes. This one has lymphoma of the iris. It's a very classic lesion with Marek's, helps differentiate it from avian leukosis virus, which has a similar presentation. These are bird kidneys. They are massive. They're about, I don't know, 20 times enlarged more than normal. They're extremely pale. They should be like liver colored, like kind of dark mahogany. They're like pale tan to pink. They're extremely soft. This is visceral lymphoma. This entire kidney is blown up with lymphoma. Okay, and another one that's FYI, because I think it's really cool, but it's probably not going to be on your boards unless you become a pathologist, which you all should. And then it'll be on your boards. Anyway. So Lucke's herpesvirus is a disease of frogs. It's another oncogenic herpesvirus. It's a natural disease. We see it in wild frogs as well as some captive populations. The virus grows in renal tubular epithelial cells, and it undergoes latency, as all good herpes do, and these frogs will develop pretty significant renal tumors at about 3 or 4 years of age. Is this a benign or a malignant tumor? Malignant, it's a carcinoma of renal glandular epithelium. This guy is cool because the replication cycle of this virus is temperature dependent. So during the cool months when the animal is hibernating, the virus is growing. The animal is shedding in the urine around all its hibernating friends that are also getting the virus. The tumor is not growing. They warm up in the summer, the virus stops growing and the tumor starts growing. So depending on when these animals die or when you sacrifice them and look at their pathology, the tissue looks very different. If you collect them in the winter or when they've been cold, you'll see a lot of viral inclusions in the cell. The virus is growing. But if you collect it in the summer, you won't see viral inclusions, but you'll see mitotic figures because now the tumor is growing. Isn't that crazy? That's so cool. I don't see a single jaw dropping. It'll hit you later how cool this is. You guys are going to dream about it. Wake up Saturday morning and be like, Lucke's herpes. All right, questions about herpes or or how cool this is? Oh, guys. All right, papillomaviruses. These are probably ones everybody is aware of. Again, these are DNA viruses, common theme. Although these are going to be host-specific, and some of them are also site-specific. So, example, canine papillomavirus tends to hit the oral cavity of dogs. Very common. This causes infections of 2 cell types. So, epithelial cells primarily, occasionally fibroblasts. So, important to remember that equine sarcoid is caused by a papillomavirus, and that is an infection of fibroblasts and mesenchymal cells, not epithelial cells. So not all papillomaviruses cause papillomas. Most of them do. Some of them cause fibromas. Some of them cause sarcoid. Some of them cause fibroblastomas. So they infect 2 different cell types. Again, don't memorize this, please. It's waste your time. But it's doing a couple different things, a little complicated. It's doing both dominant and indirect. But it produces a lot of viral proteins that for the cell cycle and cause epithelial hyperplasia. So this is one where we start with hyperplasia, progress to dysplasia, and then to dysplasia. Yeah.
Just to clarify, you said so not all papillomas are caused by papillomaviruses, but
Correct.
also not all papillomaviruses cause papillomas.
Correct.
Okay.
Yes. See? This one's not. That's not a papilloma, that's a sarcoid. Okay, and one more thing about this, this is, one of the few tumors where spontaneous immune mediated regression is common. So even though they look really bad, and there can be a lot of them at one time, they'll often spontaneously regress when they're viral inward. I have a question or just. These are some classic examples. Again, canine papillomavirus causes oral papillomatosis in young dogs. This is a sea turtle with viral papillomas caused by papillomavirus. This is called Shope papillomavirus in rabbits. It affects wild rabbits and hares. And these are cutaneous horns. They're essentially very large papillomas that are viral. Right, sarcoid, the most common skin tumor of equines, followed by squamous cell carcinoma. This is number one. They can look like a lot of different things. Some of them look like proud flesh, some of them look like warts, some of them are kind of like nodule. They're kind of mimics, they look like a lot of different things, but they're so common that if you see a weird looking thing on the skin of a horse, sarcoid should be very front of your mind. They often occur at sites of previous trauma. So this is another one where chronic inflammation acting as a promoter is part of the theory of oncogenesis. The cause is bovine papillomavirus. Remember that it's bovine, it's not equine. So this is a case of we're in an aberrant species. Mechanisms, again, please don't know this. I want you to know what the mechanisms are, but I don't care if you know who does what. That makes sense. So it's doing a bunch of different stuff. Importantly and interestingly, DNA from bovine papillomavirus has been detected in other horse skin tumors and some feline skin tumors and some tumors of other species, but we have not been able to establish a causal link. So maybe it's doing other things that we don't know about. Again, in general, papillomaviruses are usually pretty host and site specific. This one's in bovines have slutty papillomaviruses. Don't know why. I know I don't expect you to remember this, maybe the horse people in the room will, but when I'm diagnosing equine sarcoid, it's a difficult diagnosis and I need overlying skin. I have to see the interaction of the skin with the sarcoid to call it for sure sarcoid. If I don't have that interaction in that junction, I cannot definitively tell you it's sarcoid. It could be proud flesh. Have to see the junction. Pro tip. Just hang on to that for 3 more years. Okay, questions about viruses?
Question about that, so could you show like where you would want us to sample from that picture?
Well, basically none of this. That's all ulcerated and covered. So give me like junction. In general, a general principle for sampling for pathology, I like to see margins of things. So take me a margin between normal and abnormal. You cannot ever go wrong with that principle. That is always my favorite sample. Because I want to see what it's doing at the border, especially when we're talking about tumors. Because that's going to segue into this, it's going to give me an assessment of benign or malignant. What's it doing at the edge? Is it growing compressively and just kind of, it's well behaved and it's just pushing into the tissue, or does it have little fingers? Is it crawling into the tissue? So always, always, always send me the borders and the margins. Also, the middle of this is going to be necrotic and gross. I might not even be able to tell you it's sarcoid or maybe sarcoidus. It just might be like dead junk and bacteria and neutrophils if you like scrape off for this. Great question.
So if we were to send, I know nothing about sarcoid and equine, so if we were to send this in to you, do you send like the whole mass with like really good margins, or do you like, how would you?
That's a question for a surgeon.
Okay.
Yeah, so we talked about excisional versus incisional
Right.
biopsies. If you think you can get it off, you should try to get it off. The leg is difficult because you don't have a lot of extra skin there, so it's hard to close. So this might be more of a incisional or a debulking.
Aren't they kind of tricky, like
They're impossible.
yeah.
They're so hard to remove and they frequently come back, so usually
Yeah.
it's like debulk, remove, plus like adjunctive therapy, radiation, or or radiation, or euthanasia, therapeutic euthanasia. Yes. Yeah, these suck. These are malignant and invasive and they come back. Especially somewhere like here where you're not gonna be able to get good margins.